This is Toni Gabaldón. I'm talking from the Spanish Young Academy, and I create a research professor at the Barcelona Supercomputing Center and the Institute for Research in Biomedicine. Well, I'm going to give the perspective from Spain on this COVID-19 and global health. So I will try to follow the indications of how to organize this talk. So I already introduced myself. These are just two pictures from two centers that I'm affiliated. One is the Center for Research in Biomedicine, and the other one is the Barcelona Supercomputing Center that hosts one of the largest supercomputers in Europe, which has the particularity of being placed within an old church in the campus. So regarding COVID-19 in Spain, as probably you know, Spain has been one of the most affected countries, and also early on at the start of the pandemic when it arrived to Europe. Here is a plot of the number of cases. So in the peak, we had like 8,000 cases per day, and the number of deaths was around 700, 800 cases per day. So we were hit very strong, and now we have recovered from this peak, and we have, the measures have been, starting to be relaxed just now. So what has been the impact on research? So first of all, we have had 90 days of state of alarm with many restrictions to go to work. So this means many projects have been affected. Many research centers have been closed for a long time, and maybe only going there just to keep, experimental animals alive and some key resources, but it has had a strong impact, of course, I guess, like in everywhere. There has been a sudden promotion of, some COVID-19 or vaccine related projects, and many from groups that were, previously underfunded, and now they have come to the focus of the government and have received this funding that was long waiting for. There's also been specific calls for COVID-19 related projects, and what may be happening also in other places that some research funding has been reallocated to just research in COVID-19. I think this can be worried because other diseases are still existing, and it can have a negative effect in other areas. So science centers were key for the response. I mean, in many places around Spain, the scientific research centers have been used to make massive testing, like massive PCR testing, because the health system, the national system, could not cope with the requirement of doing this massive testing. So during this crisis, there has been a strong recognition of the importance of research, and the lack of funding has been now more visible. And a couple of days ago, scientists in Spain launched a virtual campaign that was called Sin Ciencia No Hay Futuro, which means no science, no future, trying to claim for, more funding for research, which, as compared to our neighbors in Europe, Spain is putting much less money per capita into research. So here are just some pictures. This is, the mass COVID-19 testing in the different research institutes in Catalonia. So they were repurposed to do this massive testing for at least the last 2 months. In my own center, the IRB, they have done about 20,000 tests in the last month or so. This is just an image from this campaign I was mentioning, No Science, No Future, in which researchers were putting on the table that yes, now everybody is interested in researchers finding a vaccine, a solution, and so on. But this doesn't work like this. Science needs to be, funded in the long term and needs to have sufficient resources. So when there is the urgent need, is more prepared than it is. Particularly in my own research, I'm lucky that my most 70%, 80% of the work in my group is purely computational. So we kept working from home as usual. We had to close the lab for some weeks, and now starting to recover the experimental work. And also, as it happened for many groups, at least those that I know in Spain, we all try to contribute from our own perspective to some COVID-19 related research, many times because we were asked by collaborators to use our expertise, like for instance, in my case, evolutionary genomics or microbiome analysis to COVID-19 related problems. And I would like also to talk a bit from the perspective of the Spanish Young Academy. So we are a very recent academy, a national academy. We were constituted in 2019, so we are just 1 year old. And we started with only 7 members, which were the Spanish members of the Global Young Academy and the alumni. But we recently incorporated 13 new academics, so now we are 20 academics, and in the next 3 years we will grow by 10 members every year, so to reach a size of about 50. So we follow with much interest recommendations by the Global Young Academy, and in this global message, these are, the recommendations for young researchers and how we can contribute. And I think from the Spanish Academy, Young Academy, we contributed. And these are some examples of how we contributed in this context. So first of all, one project we are very proud of is together with 2 research groups of one of the universities, we were issuing one daily, at the beginning it was daily report on an index that was sanitary sufficiency index. So which measures how well a health system, public health system, can respond to the number of patients based on predictions, based on data, on the number of beds in the hospitals, based on the number of people that was testing positive, and we were updating these computations every day, and we were sending a daily report to the government, structure per region in Spain, and also comparative to other countries. And as you can see, during the peak, the Spanish health system was not sufficient to cope with all the needs, and after some time, when the cases were decreasing, then we were, already on a position that, measures could be start to be relaxed. And we have been sending this every day to the government, and as far as we know, they have been using this as another piece of information to take their decisions. We have been sending also per request from the government more reports to them. One is on the weekly report on the recent developments on the COVID-19 vaccine. So what clinical trials are progressing, in which phase they are, and when it's expected to issue the results. When they issue results, we provide summary in this report. And we also have another one, which is every 2 weeks on, the survival of the virus on different environments, like how much it survives on a glass surface or on paper, and whether there is reports that it can survive in animals and so on. And we are sending these reports to the government, and from what we hear, they are useful for them. Also in terms of communication with society and fighting fake news, and also highlighting what's being done from our country, we opened this webinar series in which we were, with the overall title of How Spanish Science is Contributing to Fighting COVID-19. We were inviting researchers that were actually doing projects related to, from diagnostics to predicting the effects of pandemics to treatments and so on. And we were highlighting particularly those that were led by young researchers, and this webinar series has been very, very successful. So far, we have done 5 one-hour webinars with 2 or 3 speakers each. So just to finalize my personal perspective to contribute to this debate, well, I think the crisis has made many weaknesses of our system to come to the surface, and I will highlight particularly with respect to inequalities for access to health or other public services. And I think in general, all inequalities, between countries, between social classes, between everything now, they are, being put on the table and really clear to all of us. And, the gap is becoming larger. And also the fragility of an economy that depends on constant growth and exploitation of the environment. And we've seen the tremendous consequences of stopping an unplanned way the economy for some weeks. Also, I think it's been clear that a strong research system and efficient global collaboration is necessary if we want to face such urgent challenge, such as stopping a pandemic that is killing people day by day, and we need to find a cure. We need to stop it as soon as possible. I think this is a big stress, and you need a very strong research system that it's not. If you start finding it now, it's already late. You need to have it strong already from the beginning. So I think it's also very obvious that fake news, the role that fake news are playing in all the crises, and in this particular one, and the misuse and misinterpretation of scientific results by politicians and other stakeholders is very dangerous. And as the GYA says, I mean, the researchers have to take care of this. And last but not least, I will add an extra point, which is I've seen there has been a type of golden fever with respect to COVID research. I mean, all researchers, we have tried to help from our perspective, and everybody was much interested in hearing any new knowledge about COVID-19, that journals were asking for these papers and having fast tracks, reviewing fast publication tracks for this type of research. And I think in this fever, there's been a lot of high quality research, but also a lot of low quality research that has come through the lines due to this this hot topic that is and the strong interest. And there's been already many retracted papers and many wrong results that have been interpreted in the wrong way, and I think that's dangerous. And as our researchers, we should take care of this. So with all this, I'll finish. So thank you.